Welcome to the District 2 Hennepin County Forum on Mental Health. That's our topic tonight. My name is Kirk Thompson. I am a board member of the NAMI-Hennepin affiliate of NAMI State of Minnesota, which is an affiliate of the national organization, the National Alliance on Mental Illness. This is a candidate forum. We are very grateful to have the two primary prevailing candidates with us tonight on mental health. Blong Yang will go first with regard to the questions and introduction, followed by Irene Fernando. The questioners this evening will be John Trepp, who is on the Hennepin County Board, NAMI-Hennepin, not Hennepin County Board, the NAMI-Hennepin Board. Bruce Ario will also be asking questions along with our president, and she'll be the final questioner. Sally Vanderstrom. So I'm Kirk Thompson again. NAMI-Hennepin is a nonprofit volunteer-run agency. Our purpose is to help people with mental illness live satisfying lives and support families who support their loved ones' recovery. We engage in support, education, and advocacy for people with mental illness and their families in Hennepin County, and we would certainly request any volunteers who are interested. We'd love to have you. You can email us at NAMI, that's N-A-M-I, NAMI-Hennepin at gmail.com, or you can find us on Facebook. I'd add one, we'll get started in a second here, and I'm going to say a little bit about history. Historically, adults with mental illness were cared for in state-run and state-funded facilities. About 50 years ago, the state determined that folks would be better served in the community, and almost overnight people with mental illness became a county responsibility. Small funding streams trickled in from the state and federal government, but never enough to meet the needs of the thousands of people with mental illness, many of whom are now homeless or unfortunately incarcerated. We'll start with Blong Yang. He can introduce himself. Irene Fernando can then introduce herself, and then we'll begin with the questions, and Blong will be the first responder to the questions. Folks will have 2 minutes. Our candidates will have 2 minutes to address the questions. We'll have a concluding final statement, if you will, at the end of the forum, and then hopefully some of our audience members will ask questions following the formal question and answer portion of things. So, Blong, go ahead and introduce yourself, please. Thank you for being here.
Thank you. Hi, my name is Blong Yang. I'm running for Hennepin County Commissioner in District 2. Hennepin County District 2 encompasses St. Anthony on the eastern side, northeast, North Minneapolis, Golden Valley, Medicine Lake, and part of Plymouth. I want to thank the members of NAMI for putting this candidates forum together. I want to thank the viewing audience for watching this. If you're out there in internet world, hi, thank you for joining us as well. This is a unique opportunity to talk about mental health, and I really appreciate it. I have lived and worked in Minneapolis for 20 years. My kids go to school here. I worked here when I started my career. I started it in North Minneapolis in 2001 as a legal aid attorney, representing folks who were limited English speaking. After that, I opened up my own practice and represented a lot of different people. One of the groups of folks that I represented were people with mental illness. I was on the commitment defense panel of the Hennepin County Bar Association, and I represented or defended folks from being civilly committed. And so I have that experience. But when I talk about running for county commissioner, I mean, my personal experience has been, of a person that has received county services as well. My family did, and we were lucky enough to receive county services and also the help of churches and other groups of folks to be able to make it through, and to be able to pull myself up to where I am now. And so I really think that it's important to have somebody who has that sort of experience get on the county board and really see the experiences folks who have actually experienced the needs and experience, you know, the sort of need for help that is required, just so that, you know, you see it from a different perspective. And so that's one of the reasons why I'm running for county commissioner. And, you know, I think for myself, I mean, I'm the type of person that likes to listen to people, look at all the facts, read all the research, and then make an informed decision as to how we proceed. And I think that's really important in a county commissioner, because when you are working with a budget of $2.4 billion, you have to make fact-based, research-based decisions that affect a lot of people. 1.2 million people in Hennepin County rely on the county board to make good decisions for them. And so, you know, that's why I'm running for county commissioner. And, you know, I thank you all for being here, and, you know, looking forward to this candidates forum. Thank you.
Thanks. May I call you Blanc, Mr. Yang?
Blanc is perfectly fine. Thank you.
Thank you, Blanc. Irene Fernando, please introduce yourself.
Yeah, definitely. Hi, everyone. My name is Irene Fernando. I'm proud to be the DFL endorsed candidate for Hennepin County Commissioner, right here where we are recording in District 2. My story begins with my parents. They immigrated to this country in pursuit of a better life, not only for their kids and for themselves, but for the possibilities awaiting generations to come. In 1982, my mom started as a nurse in the same level 1 trauma center she's at today. So 36 years later, working double shifts, serving patients that had nowhere else to go, she taught me how to work hard, and that every single one of us has a story. When I was 5, my dad quit his job to stay home with my 2 sisters and me. So imagine him and 3 little girls going to the hardware store, playing chess, sitting upper deck at a baseball game. Growing up part of a large and lively Filipino family, my parents instilled in me the value of honoring tradition, while also showing me that there's power in creating tradition. That a stronger future requires both reflecting on our past and paving new paths forward. This is important because I've spent my life lifting up unheard voices and paving path where there was none. This is a responsibility that I believe the County Commission holds. These are meant to be the visionary leaders that are creating behavior and inspiring generations of those who live here in Hennepin County. And so I'm really, really excited to make sure that we are lifting up important issues like what we're discussing here, particularly because of the interconnected way that mental health is present through criminal justice, through child protection services, in our housing policy, within workers' rights, and all throughout county services. For me personally, I am excited to make sure that the narratives that I hold in my heart make it to that decision-making table. There's a 7-person board that offices on the 24th floor of the Government Center, and for the most part, many people don't know their names, and we should. For 166 years since the county is formed, we have not once elected a person of color or Indigenous person. And so I'm very excited to make sure that our stories, values, experiences make it directly to that decision-making table, because our government should be working for all of us. So I'm really, really appreciative for the conversation that we're going to have here tonight, and most importantly, looking forward to the partnership that this should signify. There are a lot of very, very important issues within each of these questions, and so it will take all portions of our communities to make sure that we are listening to individuals and families and workplaces who are experiencing those with mental illness and mental crises, as well as the professionals, to make sure that we're engaging in best practices, making sure that we're learning all we can. So thanks so much, and I look forward to our chat.
Thank you. Thank you very much, Irene Fernando. Who's going to go first on the questioning? John, and I would kind of butchered a little bit the introductions. John Trepp is he's retired, bless you, John, but he's still maintaining a lot of interest in the mental health issues, and he's a former professional in the industry. Sally Vanderstrom is the president of NAMI-Hennepin and provides great leadership for us. She is a professional in the mental health and public services field. And Bruce Ario is a client and is a dedicated board member of the NAMI-Hennepin board, and we appreciate the depth and commitment all 3 of these questioners show in their commitment to the NAMI-Hennepin board, as well as to the mental health community at large. So go ahead, John.
Thank you.
This question will be handled to flip of the coin.
And thank you both of our candidates for being here this evening. A July 16, 2018 Star Tribune article highlighted the plight of Raymond Traylor Jr., who was arrested in April, but charges against him were dropped after it became clear that his behavior was related to his mental illness. Even so, Traylor remained in custody for more than 3 months, during which time Mr. Traylor's mental state deteriorated substantially. But Mr. Traylor is far from unique, and citizens with mental illnesses continue to languish in the county jail. My question is, as county commissioner, what would you do to ensure that people with mental illness in the Hennepin County Jail receive the treatment that they need and deserve?
Thank you for the question. First and foremost, I want to point out, though, that the county board doesn't run the jails. The sheriff's department actually does. And so in that situation, I think that it's important to understand the operations and who's in control. But I think there are ways that advocates can influence operations at the jail. I'd like to see the Hennepin County Mental Health Advisory Committee be much more a part of that in terms of providing recommendations to the jail, and to have the sheriff's department, a representative or the sheriff, be a part of that, to be in the know about what's going on. But to speak to the person that was in jail for over 90 days, to me, that should never happen. That's when all the responsible folks failed to follow the law, and that's just not appropriate or acceptable. People with mental illness who need help should not be kept in jails. They should be in treatment facilities. And I do want to point out, though, that in the story, or in the follow-up stories, Sheriff Stanek actually wrote a letter to the governor, basically imploring the governor to change, whatever it was that was preventing folks like the gentleman to be in the jail for such a long time period. And I think that the county now is actually looking into seeing where the failures are at the state in terms of not having enough psychiatric beds or treatment spots, and basically creating its own beds, basically, if you will. At the workhouse that is currently not functional in Plymouth, the county is looking into fixing that up and creating more beds for folks in Hennepin County who need the psychiatric beds. And so I think it's really important to think about those sorts of things. But initially on the front end, we have to screen better. We have to screen better so that we know that folks who have mental illness can receive treatment on the front end and not on the back end, and not have to wait for 90 days or over 90 days, because that's us not being responsible for what the law requires.
Yes. In this story, thousands of stories that take place, that is a system to make a difference in. And so let's break down, there's several aspects here. First, I believe the lens of individuals who are experiencing mental health crises, and that is not the way that we should be engaging with our neighbors and our community members. Oftentimes people who are in these settings are in in lower wage communities, communities of color, and so we are kind of inadvertently at our system enforcing. And criminal justice is beginning to really be stepping back and of being, from the person who's receiving care, how are we making sure that we are holistically looking at that individual so they can navigate the system well and receive the support they need. I know that we are not technically in charge of the jail, as said, and we have, through Health and Human Services and through many programs, have many opportunities where prior to a misdemeanor even being charged, or prior to somebody being in the criminal justice system, the county commission can convene and intervene in ways that are, person-centered, that put the integrity, dignity, and humanity in the person, and where we can look more holistically around how someone can be contributing holistically to our society versus criminalized in our jail system.
Thank you. We'll switch to another question. Bruce Ario, please direct your question to Ms. Fernando.
Ms. Fernando, people with mental illnesses in the Hennepin County Jail are sometimes placed in solitary confinement, even though such treatment is known to aggravate mental illness. As County Commissioner, What would you do to limit the use of solitary confinement as an option in the Hennepin County Jail for people with mental illnesses?
Yes, I believe in a criminal justice system that focuses on people and rehabilitation. So anything that is remotely considered cruel or unusual, as you stated, is not something that I'm in favor of at all. We have an opportunity to make sure that we are advocating from the perspective of those who are experiencing mental health opportunities and crises, and those around them, because there are cascading impacts related to housing, related to child protection services, related to employment. And so, specific to this question, I will work to ensure that people with mental illnesses are in facilities that best support their situation, which likely doesn't mean county jail. And so you'll see a theme there that oftentimes once we get to county jail, we need to be moving from that structural problem to begin with. We're already in a place where I don't believe is putting the individuals in their best interest, positioning them for long-term success. I also believe we need to secure legal protections for those who are incarcerated and are diagnosed, such as the story said earlier. And we must also work with those who are in jail as employees to make sure that they are educated and destigmatizing the scenarios that we're placing here. Again, people-centered, person-centered, maintaining the humanity and the dignity of each individual, I think, is of the utmost importance.
Thank you. Long Yang, same question.
Thank you. For me, I think it's really important that we treat people for their mental illness, and that solitary confinement cannot be a measure of treatment. It cannot be a treatment option. We have to really think about how we approach that. But I do want to just take a step back and just recognize that there is a separation between the county board and the sheriff's department in terms of the operations of the jail. But I believe that both the county board and the sheriff's department are both in agreement that jails are not adequate places for people with mental illness. And I think that's evidenced by the sheriff writing the letter to the governor, basically saying that our jails are not places that we should be treating folks, and that we need to open up more psychiatric beds for people. And so treatment should be in a setting outside of jail where psychiatric beds are available. And I actually think Hennepin County is actually making some waves by being innovative in terms of looking at the workforce or workhouse and basically converting that to a place where there are enough beds for treatment, and recognizing that within the context of Anoka Metro Regional Treatment Center or St. Peter's Regional Treatment Center, that the beds are not there, and that the law requires that 48 hours we give priority to folks who are in the jails to receive treatment, that Hennepin County says there is a void and we are going to create new beds. We're going to do the best we can to provide treatment for anybody that is in the jails. I mean, I think we have to give credit where it's due, and I think in terms of the county, they are working really hard. And you know what? I think that, as an advocate community, we can push for Hennepin County to be better, but certainly I think that it's doing much more than, other counties across the country, and I think that, we should, give the county, a tip of the hat for doing that.
Thank you. Sally Vanderstrom, please address the next question, and Blonde Yang will begin.
Thanks to you both for being here. We really appreciate your attendance and talking about this really important subject. Law enforcement officers receive mandatory training in the use of firearms, but a Hennepin County sheriff is much more likely to encounter an individual in a mental health crisis than to encounter an armed criminal. As county commissioner, what would you do to assure that all first responders employed by Hennepin County sheriffs receive adequate training in handling mental health crises?
I served on the Minneapolis City Council for a term from 2014 to 2017, and I was the chair of public safety. And what Minneapolis Police Department did was they had a crisis intervention team that received training on handling mental health crises. I can never pronounce the IS or the ES for crisis, but I meant that in the context of a lot of crises. Crises.
Crises.
Crises.
Crises.
But I think not only that, but I think that, you know, what the city did on top of that was the city adopted a co-responder model that basically says, you know, we're going to handle any sort of mental health crisis by bringing a professional along with an officer to assess the situation and give the best we can in that situation. And, you know, I think that the Sheriff's Department can be served by having CIT training, but also having, you know, or adopting a sort of co-responder model that is looking at, you know, how we address mental health crises, and do it in a way that is really responsive to the needs of folks that are in crisis. And so I think, I mean, those two things are, you know, two models that, you know, certainly, you know, we should consider. And, you know, I would encourage the Sheriff's Department to look at those two things and to study them, because Minneapolis has had the co-responder model for, I believe, a little bit over a year. I mean, the CIT training that they've had for, you know, specific officers, they've had that for, I want to say, over a decade. And so to study that and to really see if we can adopt that for the county.
Thank you. Ms. Fernando, your turn.
Yes, we need to be focusing on de-escalation. I believe that law enforcement needs to be less to decrease the amount that we are in other communities that often are our most vulnerable. And so specific to this, it is disheartening to me that law enforcement is even who was, you know, the county is responsible for 911 dispatch for nearly all, if not all of its 45 municipalities. The county also has this program called COPE. So COPE is a way for individuals who are experiencing mental health crisis to be able to call someone and have a mental health professional respond instead of law enforcement. I'm really interested when I'm county commissioner to convene the question around how we might be able to overlap 911 dispatch and this program that already exists within the county called COPE, so that we can ensure that our residents are receiving the individuals who are best equipped to care for the situation, for themselves and those around them. Oftentimes, if someone is experiencing a mental health crisis and other situations are taking place, there are perhaps misperceptions around what is going on. And we need to see people with, again, compassion, de-escalation, and ensure that structurally the county is prepared to meet individuals in a way that best supports them where they're at. Thank you.
Thank you. John, please address your question to Irene Fernando.
The recent encampment along Hiawatha Avenue in South Minneapolis highlights our persistent difficulty in providing adequate housing to our citizens. And it is understood that perhaps as many as 50% of homeless adults in Hennepin County are so, at least in part because of mental illness. As County Commissioner, what would you do to address homelessness among people with mental illness?
Yeah, so homelessness and mental illness, as you say, and for the individuals experiencing either of these scenarios, there are often multifaceted situations taking place. It's related to workforce, related to income, related to domestic violence, related to situations that we as a community need to stand up and stand by individuals. So I think the county is uniquely positioned because of the way it is, the way we're organized. People that are receiving more than one service from the county, like people who are, again, in need of housing assistance or in need of mental health support, how are we creating specific programs that allow for assistance in these settings to be more holistic? When, if I'm somebody who's experiencing who needs multiple items, and I'm going from kind of department to department, navigating that, again, once I'm in this scenario, I'm already in need. I'm already in crisis. To have to navigate a highly bureaucratic, often fragmented system on top of that does not position me for the success in order to get out of that situation. And so when we start seeing individuals for their whole selves and seeing the county as a whole solution creator for individuals, we will be able to kind of lift individuals up from responding to symptoms to addressing livelihood for our residents.
Thank you. Mr. Blanc, Mr. Yang?
Blanc, that's fine.
We'll get it right
Yeah.
before we're done.
You know, the county has a lot of mental health services that it can provide, but I think, you know, initially, you know, it's a screening or the assessment, and you know, we need to do a better job of working with St. Stephen's and other providers to look at, you know, folks who are homeless and to give assessments and provide treatment, because I think that a lot of times, you know, we forget that when we provide treatment on the front end that's preventative, I mean, we're going to save a lot of money on the back end. And so when we do that, I mean, we have to think about, okay, how do we provide services for specific folks? Because, you know, I mean, we've heard stories about the encampment and, you know, the needs of some of the folks in the encampments. And, you know, what sometimes, you know, is, you know, fairly simple for us is fairly complex for other folks. But I will say, you know, sometimes you see a story where, you know, let's say a mother who is, let's say, an addict who has mental health issues as well, but has a family of 4, and we don't have facilities for folks like that, you know, and so we have to think about, you know, these sorts of holistic solutions that actually, you know, address, you know, a whole family. And sometimes family doesn't mean just, you know, a husband and wife and 2 kids. Sometimes it means a husband and wife and 5 kids or 7 kids, or, you know, a husband or a woman and her partner and, you know, other folks along with that. And so, I mean, I think we have to be very responsive to the needs of folks who actually have needs. And, you know, to that extent, I mean, in terms of providing housing, I think that we have to work with cities and also other entities to really figure out how to address these issues better. But, you know, I mean, we're seeing within the Hennepin County Board that, you know, they have actions that are addressing the encampments just in the next couple of days with regards to funds from the state and the county. And so, you know, I mean, I think we're making some progress. We just need to do better.
Thank you. Bruce Ario, please.
Oh, Sally's next.
All right. Sally, sorry about that.
That's all right.
This question will go again to Long Yang.
One major cause of homelessness among people with mental illness is the extreme shortage of aftercare beds. And it has been estimated that at least 25% of our psychiatric hospital beds are filled by patients who could be discharged, except for the severe shortage of aftercare beds available in Hennepin County, which leads to a whole host of other problems. As County Commissioner, what would you do to address the critical shortage of aftercare beds?
You know, the shortage of aftercare beds, I mean, I think on one hand, we have to think about how we provide those beds for people, but also how we slowly move them out of those beds. And so on the back end, I mean, you know, as a county, but also, you know, working with the cities, and we have to be thinking about how we find housing for people. You know, I think generally speaking, I mean, there's a shortage of housing, and or housing is just way too expensive for most people to be able to get into. And so, you know, I think, I mean, that's the part where, you know, when I look at, you know, problems with housing, I mean, sometimes I see that, you know, we spend a lot of money on specific programs, or we spend a lot of money on, you know, different things that, you know, we should be thinking about, okay, how do we actually address the person's issues? You know, if it's housing, I mean, how do we find housing for that person, but maybe other people as well? You know, and I think that, you know, those are kind of the issues that we have to really consider when we think about, you know, aftercare beds, or what happens after aftercare beds. Because, you know, we can have as many aftercare beds as possible, but, you know, if there isn't anything on the back end to provide housing after that, well, then we're just going to create a lot of aftercare beds without housing on the back end. And so, you know, those are kind of the things that, you know, we have to address, you know, as the county is, you know, at some level we have enough aftercare beds. Now we have to think about how people land in the community. How do we find housing for people? What do we need to do to work with housing providers? Or do we create housing on our own, basically, to help with folks? And, you know, at least with Minneapolis, I mean, Minneapolis is its own HRA, and so they do their own, you know, housing development, or they work with other developers to do that. But, you know, in other cities where the county is the HRA, I mean, we need to be working with those communities to provide for that sort of housing on the back end.
Thank you. Go ahead.
Yeah. First, I believe that we need to be asking who's impacting those who are administering care. Like I said, my mom-in-law is me that the perspective of those administering the highest quality care that they can, our perspective is and answer is that all layers of leadership, all the way to the county commission, needs to be paying attention to. The county commission is actually responsible, for example, for hiring the hospital CEO at HCMC. The county commissioners are on boards at North Point, at other clinics, is responsible for Hennepin Health. And so the county commission, yes, maybe there's some distance there, does have a direct responsibility in ensuring that we have holistically the model that is needed to provide the hospital systems. And so when part of this might be some admissions managed at a time where we are, as well as it is appropriate. And so I believe can be.
Thank you. Okay, and let's just remind our audience that's perhaps watching what we're doing here. This is the NAMI-Hennepin Candidate Forum on Mental Health. We're glad to be here with the two primary prevailing candidates who will be on your ballot this November. Irene Fernando and Blong Yang are taking questions on mental health for our forum. Sally Vanderstrom, please address this question to Ms. Fernando.
Each of you have addressed our current shortage of affordable housing. This shortage traps people with mental illness in aftercare beds long after they could leave. As County Commissioner, what would you do to ensure that Hennepin County's efforts to increase the supply of affordable housing includes increasing the supply of supportive housing for individuals with mental illness?
Yes, definitely. And so housing, there is a lack of affordability of housing, so that has to do with income, that has to do with economic development, workforce development, many things. Also the lack of affordable housing as well as available. And so that means we do not have enough homes. And so people are one eviction away, one misdemeanor charge away, from work and whatnot away from being in a situation that they can't get out of for their families for decades, literally decades. And in fact, in District 2, 50% of all the evictions in Hennepin County are in District over North Minneapolis. And so when we talk about affordability in general, a supply of who are experiencing mental health, the county can say, instead of you as one individual receiving services from different business, how are we integrating and making sure that we are providing housing for those who are clients to the county in more than one manner, and seeing their whole family as a part of that opportunity. And also, when we're doing that, how are we making sure that we are motivating the behavior that we want? A lot of the programs that we have right now, once people get stable enough, right, enough income, just enough income, they actually are moved out of those programs. We need more gradients, a bit of a mezzanine into a stronger practice in their lives.
Thank you.
Sure. Each of you addressed our current shortage of affordable housing. This shortage traps people with mental illness in aftercare beds long after they could leave. As County Commissioner, what would you do to ensure that Hennepin County's efforts to increase the supply of affordable housing includes increasing the supply of housing for individuals with mental illness?
Okay, so I want to start out by just saying that Hennepin County is not a developer of housing, but it does facilitate the development of housing. And it does this through several loan programs, including the Affordable Housing Incentive Fund, among other funds. And so we have to think about this in terms of partnerships with developers, partnerships with community groups that want to develop housing for specific groups of folks. And when I was on the city council in Minneapolis, in the time that I was there, I mean, we developed 600 units of housing for people, and those were workforce housing type houses. We developed or we incentivized folks to rehab homes as well, to not let the city demolish homes and get people into housing, whether it was rental housing or ownership of housing. And so I think, with that experience, I'd like to say that, when we think about housing, we have to be partnering with different groups of people. And, when we think about partnering with different groups of people, here's kind of the outlook. Developers want to make money. If they look at housing for folks with mental illness as something that's profitable and that makes a lot of sense and they understand it, they're going to do it. The problem is, that they've been doing other things and they don't see this as a place where they can make money. And so, we all, it's incumbent upon all of us to encourage them or persuade them that this does make money. And so if we can do that, then, developers can be much more interested in building that type of housing. And so when we think about that, we have to think about how we do it. And I would love the opportunity to be encouraging people to build housing for this. And I'll give you an example. Great River Landing is a facility that is housing ex-cons in the North Loop area. And this was Beacon Interfaith Housing Collaborative, along with Better Futures Minnesota, that came together and said, this is an opportunity for us to develop housing for people who have criminal backgrounds. And so I think, that sort of synergy is what's required to build housing for folks with mental illness.
Thank you very much. Bruce Ario, Blonde Yang will be the first responder.
That's a great.
Around 17% of individuals with mental illness who are willing and able to work have the opportunity to do so. As County Commissioner, what would you do to increase employment opportunities for people with mental illness within Hennepin County?
So 17% of folks with mental illness are 30% that are out there that have an opportunity to be employed. And when we talk about that, and then we talk about the shortage of labor that's coming right now as we speak, but in the near future, that's something that we have to work really hard on. And I think at the county, with the county's Pathways program, it's a program that actually is helping folks who do have mental illness, who are, let's say, income challenged, to really get a career, work at the county, develop skills or trade skills that will allow them to have good income, good paying jobs, and also, a good history basically. And so I think, the Pathways program is, is kind of a pilot or an example for us to work within the public sector, but we need to transition this out to the public sector. And I think a lot of times, it's important for leaders, such as a county commissioner, to really talk to the private sector and encourage them and let them know that there's 83% of folks with mental illness who want to work and will be great employees, and you got to push that. And sometimes you got to push that as hard as you can, whenever you can, so that people believe that. Because I think that the stigma attached with people perceiving persons with mental illness as maybe a problem or not a good employee and all that stuff, we got to cut that, and we got to work really hard to encourage people and let people know that there are really good people who have mental illnesses that are controlled, that can go to work and can provide as much as they can for an employer. And so sometimes it's just about persuading employers to do the right thing. And I think that's the important part, is that we have a big job to do, and that's to convince people, employers, that the labor market shortage that people talk about, sometimes that's just a mirage, and that the reality is that everything's right there already.
Thank you.
Yes. So first and foremost, we must destigmatize mental health. Period. We must increase our education. We must increase access to services. Question. employers and other health providers, we need to be expansive when we think about mental health and the which we, as someone who has worked on require utilization of items we think of, right? When physically come, we need to be engaging in practices. We are logical age where we work in mental health, needs, but just created in a way that helps individuals thrive in ways that we might not have traditionally defined. And so that is quite exciting. I've spent the last 15 years at a corporation in a organizational design setting. And so when we speak about the 8,000 person workforce that the county has, as well as the ways in which the county can be convening across all different sectors so we can be a leader in how we can engage this with a mental health and healthcare lens.
Thank you. John, Trepp, please address the next question to Ms. Fernando.
This past March, we at NAMI-Hennepin released a report on the use of peer support by providers of mental health services. In a time when provider agencies report difficulty filling open staff positions, we were surprised to learn that peer support is greatly underutilized in Hennepin County in comparison to other parts of the country. As County Commissioner, what would you do to expand the use of peer support services in Hennepin County?
Yeah, so I think this is an opportunity, again, first and foremost, how do we destigmatize and ensure that we are health? And then how can we expand individuals that see themselves as a part of peer support, right? So peer support is centering on compassion, on using friendship and relationship building as a medium by which we can help individuals kind of, see themselves advance on their respective journeys. There are many opportunities across the county where a lot of times people are just unaware that this offering is available. I've been really amazed with some of the programs that the county offers and how that there's a disconnect between that and the residents of Hennepin County. And so I would I'd be interested in expanding this peer support program by going into the communities that are disproportionately impacted by mental health, incarceration, criminalization, low-wage communities, communities of color, et cetera. And how, can you imagine if, when 911 is called, we spend a lot of resources bringing cops in, bringing people to consider culpability. What if we spent a fraction of that for mental health response, for trauma, for healing? And what if we incorporated peer support as a medium by doing that? That gets at community centricity. That gets at communities and individuals finding strength within themselves. And that frame needs to be at the center of how the county is engaging with residents and communities.
Thank you. Longyang?
Yeah, I'm going to keep this simple. The Mental Health Advisory Council has highly recommended this. And I think when you have these councils, you have to listen to them. You can't just have them just for the sake of having them. And by that, I mean, if they're highly recommending it, the county needs to work on adopting it and expanding the program, and I would advocate strongly for it.
All right, Bruce Ario, please address your question to Longyang.
We read of tragic acts of violence committed by individuals with mental illness. More times than not, we read the individual or the individual's family had tried to access mental health care but had been turned away. As County Commissioner, what would you do to foster a more user-friendly mental health system in Hennepin County so as to reduce the need for involuntary treatment and reduce the risk of such tragedies occurring here?
So I think with our mental health system, I mean, we really have to be committed to this idea of like serving everybody, or we have to just let the community know that, you know what, we're going to serve a certain segment of folks only. And I think what I mean by that is that, you know, are we going to just provide services for folks who are means tested, folks who are low income, you know, those sorts of things, or are we providing it for everybody? And if we're providing it for everybody, then, you know, we need to create systems in place where these services that we're providing, we're doing it in a way that really holistically treats people. And from start to finish, I mean, we're working very hard at providing these services and doing everything we can. And, you know, I don't think that, you know, treatment is a situation where we're providing the services regardless of funds, because, I mean, realistically, I mean, there are only, you know, a finite number of dollars that we have to treat people. But, you know, for the folks who need the most services, we definitely need to provide the services, and we need to, you know, be thinking about how we do that in a way that, you know, triages, but also is thinking about how we best serve people, so that, you know, those sorts of red flags for certain people, I mean, are not red flags, you know, and we should be picking up on those red flags. And with, you know, the sort of experience that we've had for a long time, and we should be doing a better job. And that's the part that is really important about this, is that, you know, the county needs to work really hard on eliminating these red flags so that those sorts of tragedies don't happen.
Thank you. Ms. Fernando?
Myself, along with, I'm sure, many people in this room, you know, scenarios with mental health or people with our families, we are in these scenarios. We are already, again, at different times. And so to navigate a beer, I believe, inappropriate. So first and foremost, we need to answer the structural opportunities. I stated this earlier, but the structural training that we've all been provided as members of society is calling 911 when you need help. So when we consider an expansive way of engaging with 911, so that it's, again, already integrated with an existing program called COPE, so that we can determine, the dispatcher might be able to determine, how are we coaching this individual through that? Who are we actually sending to this physical location? That is a structural opportunity that the county can do within its operating. The second structural opportunity is within data. So this is where we may disagree a little bit. I believe that where there is disproportionate impact in communities, we must be responding with disproportionate resources. It is shown over and over again that individuals in these scenarios are often at greater risk of being incarcerated, of being evicted, of not landing jobs, of having their children taken away from them. We can't see these as siloed instances. And so I believe that we need to structurally, in our response in the community, as well as responding to this disproportionate data with disproportionate resources.
Thank you. Armstrong, please direct your question to Ms. Fernando. Thank you.
Our own research has revealed appreciation for the mental health services available in Hennepin County, but also considerable frustration that the best services are either time limited, means tested, or have impossible wait lists. As County Commissioner, what would you do to ensure that effective services are more easily accessed and remain in place until an individual is ready to become a productive member of society? Yeah,
definitely. This is one of the biggest reasons that I wanted to run for County Commissioner. We need to get to a person-centered approach, really at the individual level. We have emergency services as a county, for example, that on the website it says up to a 30-day wait period. How does emergency services exist on the same website? Crisis. I've then Googled Hennepin County services, and then it still might take a form in 30 days. That means the system is not. The system was just never designed. I'm very committed to bringing to the board. That means we're not just tweaking upon existing processes. If we're tweaking upon existing processes, that means we're on processes that are decades or maybe even met with bigotry and with discrimination. And who is that? We need to ensure that not who are implementing these decisions and are impacted by these decisions, not only that their voices are there, but that they're at the decision-making table, constructing the solutions, and then they're the ones grading. The county, the individuals who are in our county get to grade the county commission.
Thank you. Long Yang?
So I'm going to start by just saying, I mean, there's no such thing as a county commission. I mean, there's a county board that makes these decisions. But I mean, my thing is, when we talk about people-centered approaches or us, I mean, what about them? And I think as a county board, I mean, you're making decisions that affect everybody, the 1.2 million people in Hennepin County. And I think that's an important part about it, is that when we address those 1.2 million people, I mean, how do we do it in a way that works for everybody? And yes, I understand. I mean, you know what? Look, I mean, Hennepin County has a history, where the county board has not ever had a person of color. But I mean, I think we're talking about this as though, like, I mean, somebody of color is going to get on the county board. I mean, I think that's the most critical part, and that's important. And I think we forget about those sorts of things, because when we create systems, we have to create systems that apply to everybody. And to me, I mean, when you look at all the things that, Sally, you talked about with regard to unrealistic expectations, I mean, the idea is that the county needs to evaluate, needs to create an evaluation system for consumers that use the system. And the county needs to do a better job of trying to fill in those gaps, doing everything we can so that it does apply to everybody. And when we create a system, not only are we creating a system for white people, we're creating a system for people of color, we're creating a system for people with mental illness, we're creating a system that works for everybody. And sometimes those things are impossible, but that's when we realize that, then we create separate systems for different groups of populations that are, in need. And I think that's the part that's really critical for how we proceed as a county, is we need to be driven by data, but we need to also be asking for the consumer experience and then fixing those gaps and listening to our consumers. But not only our consumers, we have to be listening to our staff as well.
Thank you. Mr. Fernando?
I think I...
Yeah,
she did.
Yeah.
Or I knew it.
That's
I can answer more.
no.
I have plenty to
What
say.
do we got, John?
Indigenous people and people of color are dramatically underserved by our current mental health system. Compared to the general population, African American adults are 20% more likely to experience untreated mental health issues. Native Americans have the highest rate of young adult suicide. 1 in every 10,000 Hispanic men will die by suicide. And Asian American adults are less than half as likely to seek mental health treatment. There's also a notable shortage of mental health services for our LGBTQ community. As County Commissioner, what would you do to improve the delivery of effective services to Indigenous people, to people of color, and to the LGBT community in Hennepin County?
So when we talk about improving the delivery of services, I think we really have to think about how we do it within the context of these different communities, and how do we do it well. And I think one of the most important things that we have to do is to hire service providers that look like them, that are a part of those communities. We have to contract with agencies that look like them, or that provide that sort of cultural competence service for those specific communities. And cultural competency is critical to the delivery of services. I'll give you all an example. I mean, when I worked at the Legal Aid Society of Minneapolis, what we were finding was that if legal aid never hired a Hmong person, either as a paralegal or a staff attorney, then the question was, why are there not Hmong clients that are showing up at legal aid? But when legal aid hired a Hmong attorney and or a paralegal, all of a sudden there was this increase in the number of Hmong clients that showed up. And I think that sounds simple, but I mean, it is true. I mean, a lot of times, one person who, let's say, is the go-to person on mental health in the Hmong community suddenly creates, this whole group of people that we never saw before, who are, people who use mental health services that suddenly show up there. And I would say, that applies across the different communities of color. I would say that applies to folks who have mental illness. I would say that applies to a lot of different things, is that when you have a go-to person that you can go to, I mean, all of a sudden, it makes it much more easy, it makes it much more comfortable for you to seek those services. And I want to just, end by just saying, for me, I mean, like growing up, my parents received mental health services through the county because of PTSD. My mother-in-law suffers from PTSD and received those sorts of services too. And it was critical that they went to a place that provided people who understood them and or had an interpreter that helped them to understand things. Because sometimes, what we see with these, communities of color is that, we try to fit a square peg in a round hole, and sometimes that doesn't work. And so to provide providers that actually can provide those services in a competent way is really critical.
Thank you. Mary and Fernando.
Yes. We need to employ people from the community. Even without the and you go way to the top of that org chart and it looks nothing like before the need and grow in those settings. Number two, we need to integrate our services with other where people are already. For example, we need to be partnering, in my opinion, directly with schools and school districts. County Commission does not have a direct line into education. We can have a direct line with ensuring that mental health offerings and other clinics are on site in schools where young people are already comfortable, where parents are already comfortable, where families are already going for different reasons. Third, we do need to contextualize for culture. I grew up in a city that was predominantly Filipino, and my parents spoke Tagalog to all of the individuals who helped us. And if people didn't speak Tagalog, then we had to come with. And so how do we contextualize our training and our services specifically to the communities that we're speaking about? And we're not a monolith, right? No organization, no group is a monolith here. And so when we're talking about different communities, really making sure it's super localized. And last, to ensure that we are then providing proper services if there are specific issues that are coming up. So for example, with the LGBTQ plus communities, specifically with transgender individuals, sometimes, depending upon if people are in jail or at other facilities, for example, you're separated by gender or biological sex assigned at birth. And those can have really, really tragic and harmful repercussions when we are not incorporating in the entire process as much inclusion and as possible.
Just get that, just go to this.
I'd like to ask our panel, we'll do a little bit of this on the fly. We can ask another question. We are also getting at about 1 hour where we could have some audience questions, and the candidates can conclude with some brief remarks at our Hennepin County Commissioner Race District 2 Mental Health Forum, sponsored and put on by NAMI-Hennepin. Two more questions. Two more questions, all right. Sally Vanderstrom, direct your question, please, to Ms. Fernando.
All right. There's been significant criticism of the child protection system within Hennepin County, but little consensus in defining the real problem and even less agreement on plotting a path to improvement. Mm-hmm. As County Commissioner, what would you do to improve the performance of Hennepin County child protection?
Yeah, this is one of, I think, the most important areas that we can make a difference. My reasoning is because as county commissioners, we can of course influence and legislate, but child protection services is fully within the operating structure of the county. We can actually make a lot of difference without requiring votes. To put this into some perspective, there are about 16,000 young people in foster care in our state, and about half of those individuals are in Hennepin County. And so again, disproportionate data must be met with disproportionate resources and response. So first and foremost, protection services. What about prevention? What about care? How are we even in the title? How are we framing this in a way that we're keeping young people at the center and hopefully families together? Oftentimes, I believe that we are a bit quick to remove young people from their household. So out of home placement is something that should be exercised in instances of abuse and neglect, of course. But in instances where there is a mental health illness or experience taking place, how are we actually providing more services so that the family can stay together and learn how to engage with this kind of new normal and new way of living? because we want people to be able to, grow in themselves and grow as members of society over time. And so in terms of improving the performance, this is one of the areas that I'm hoping to be a very strong advocate for child protection services, and again, even expanding what CPS even means.
Thank you. Long Yang.
Thank you. When we talk about disproportionate problems requiring disproportionate responses, let me just tell you, the amount of money we spend on child protection, over $100 million. I think we're going to be close to $120 million per year on spending on child protection. And that was in response to the county failing in the past. And we need to improve that. But let me just give you perspective on the $120 million. That's almost the same number as the sheriff's department, basically. Which means that, the county is providing that sort of disproportionate response, that sort of response that is necessary to make this system better. And, I will say that, when you look at the child protection system, the county is making some inroads. They're making improvements, and they're making improvements because the Casey Foundation came in and did an evaluation of the county child protection system and said, you know what, these things are inadequate and we need to improve. And the county practically doubled its staffing for child protection so that the county can respond to these things, and so that there are no red flags, so that there are no stones unturned with regards to the issues. And a lot of what we think about with regards to child protection is, in the past, it's been neglect or abuse that has been the primary driver of child protection issues. But, all of a sudden we are seeing that now it's drug addiction that is causing that sort of problem. And so when we see that, we have to really think, okay, the county is responding. And not only is it responding, in some ways, if the funds are not enough, the county needs to advocate at the state for more funds to be adequate in terms of child protection. And so I wholly support that. My experience in the past, working in child protection, as an intern, but also as an attorney representing parents in the child protection matter, is that, we have a long, long way to go.
Thank you. Mr. Fernando?
No.
I did that one.
Or you did that?
Kirk, one more question.
So
One more.
I have the honor of asking the last question from the panel this evening before we go to the audience. Even though the bulk of mental health services provided by Hennepin County are supported by state or federal funds, many of the solutions to the problems discussed this evening will require the commitment of at least some county tax dollars, putting them into competition with each other and also with a broad array of county services. As County Commissioner, which of the issues discussed this evening will be a priority for you, and what is the level of your commitment to improving the Hennepin County mental health system?
So I'm going to say this. I think tonight, has illustrated that mental health is a really important issue all across the county, and that the next county commissioner for District 2 needs to pay attention to the mental health issues that are out there, and needs to advocate strongly for folks with mental illnesses. And so for me, with my experience representing folks in the civil commitment process, my experience representing folks in the child protection process, and also just having family members and friends who have mental illnesses, I think it's really important that we need to take that escalates into other things. And so, for us, it's really important for us to be preventative and taking care of the issues on the front end. And so I will be a strong advocate.
Fernando?
So child protection services is a space that I want to be an explicit advocate for. This has had varying levels of commitment in the past, and I want to be very, very clear that this would be among my top priorities. This may be a space, agree. I hear you that $100 million. For 8,000 people, I think we can spend $100 million in more innovative ways. How are we investing in that, advancing it, then responding to symptom here? Second major is housing for individuals and families who are benefiting and receiving another county service. To make a really big difference in the lives of all of those who live, work, and spend time in Hennepin County.
Do we have address some questions from the audience?
We're all strapped in here.
All right, we're ready to go. We got any questions?
Good evening, thanks for being here. Do you support the rail proposed from Eden Prairie to Minneapolis and back? Why or why?
You know, we're here for mental health forum. If the candidates want to briefly address that question, they can do so.
Go ahead.
Yes, I support Southwest LRT. I voted in the past, on the Minneapolis City Council for municipal consent, and I will continue to support it. I think that within the districts there are parts of the district that don't support it or don't like it because they don't feel the benefit. But I think overall, it's a plus for all of us. 30,000 jobs within that line, and so I think it's a good thing for us.
I also support mass transit. The reason I support regional mass transit is because Hennepin County is the most populated county in our 87-county state, and we must be a leader in ensuring that we are expanding regional mass transit. It is not an either or, though. I am also an advocate for bus rapid transit now to ensure that we are not only impacting behavior, so people are accustomed to engaging in transit-based lifestyles, but also so that we can test. Let's make sure that we are, putting metro transit infrastructural routes where communities are in need of them.
Hi, Bill Koke. Excuse me. What part of your experience qualifies you to be the best advocate for mental health issues as a county commissioner?
Ms. Fernando, why don't you start with that?
Yeah, definitely. So my experiences range from small business to large organization. Why that's important is because the county is a big organization that needs to inspire a vision among varying clinics, communities, different backgrounds to make sure that we are, again, structurally advancing and advocating for those who are experiencing mental health crises, who are in need of mental health support. Secondly, one of the big things that I did when I was about 17, I co-founded a youth leadership nonprofit. During my 11 years there, 22,000 students came through our programs. And so I've actually traveled all across our country with thousands of individuals of all varying backgrounds, incomes, from the smallest towns to the biggest cities. And so a lot of what advocacy in this space looks like for me is looking across someone and seeing them as an individual, as a person first, and working to meet each individual where they are at, and then reflecting that again in the structural operating organization. So I believe that I hold those two in a unique manner, and as a result, I can advance both the vision that we have as an individual person.
Long Yang, can you handle that one?
Sure. I worked at the county attorney's office in the child protection division, or then called the early intervention and prevention division, working with folks to really understand how to prosecute, but also how to help people go through the system. When I got out of law school, my first job was working at the Legal Aid Society of Minneapolis as a staff attorney, helping people who didn't speak English to get government agencies to provide language services for them. And for people who don't speak English, according to Minnesota law, they're considered people with disabilities. And so in that regard, I helped a lot of folks to get language services for themselves. When I was a solo practitioner, I defended folks from being civilly committed. I went to St. Peter Regional Treatment Center, went to Anoka Metro Regional Treatment Center. I've gone to many of the psychiatric wards in these hospitals, from Southdale to Methodist to HCMC and a number of other places. And then, on top of that, my family experiences, as refugees, there was a study that was done that basically says, refugees suffer, at significantly higher levels of mental illness than just the standard population. And so in that regard, you know, I lived it. I've seen my parents, you know, go through that sort of experience. And, you know, I think, I mean, at the heart of it though, I mean, my experience, you know, has guided me to this place. But, you know, I served on the Minneapolis City Council for 4 years, and, you know, I have, you know, budget experience with a budget that was $1.2 billion annually. And, you know, so that transfers fairly well, I think, you know, within the context of a budget of $2.4 billion. And so, I mean, those sorts of experience really, you know, prepare me for this job, I think.
Thank you. Any other audience questions? Okay, we're gonna wrap it up here. Those last.
I'm sorry, there is one more.
Oh, okay, one more.
Thank you. What will you do to address the problem of adverse childhood experiences in Hennepin County?
What was that?
What will you do to address the problem of adverse childhood experiences, or ACEs, in Hennepin County?
Irene first?
Either one.
Yeah. Okay.
Ready for it?
Sure. You know, so could I get a definition for that? I mean, is that like a specific term, or is it just?
Yes, it's used to describe adversities that children experience until the age of 18 or so, including traumatic experiences like abuse, neglect, but as well as exposure to other forms of violence, and household psychopathology, parental incarceration, exposure to neighborhood violence, and so on. And so they have important consequences in terms of mental health.
Thank you. So I just am going to start here by just saying, you know, I mean, I would say both Irene and I are both not experts in mental health. You know, we, you know, are doing the best we can in terms of, you know, trying to answer the questions, you know, as if we were the county commissioner, or, you know, of District 2. But, you know, with regards to that, I would say, you know, the county needs to work hard with the school district to provide services. And, you know, in terms of like the school districts and the county, I mean, they're somewhat separate entities, and there are, you know, several different school districts within District 2. But, you know, for the county to work with the school districts to really figure out how to provide those services, and if it's a partnership that provides those sorts of services for children who are in need of services. And so, I mean, I think that's critical to anything, is that, you know, we need to provide, you know, folks who are psychologists or psychiatrists or therapists, or, you know, any of the, you know, professionals to really, you know, get at helping, you know, children or kids who go to school to develop and, you know, to address the trauma that they've suffered, and to really help them to become healthy citizens. Because I know, you know, in the community that I live in, North Minneapolis, I mean, you know, a lot of the kids that go to the schools, you know, have those issues. And, you know, I think, I mean, to address that really requires professional help. And so as the county board, I mean, the issue becomes, how do we help fund that? Or how do we figure out to support programs and fund those programs so that we can better address or treat those children?
Nando?
Yeah, I think in part the answer is in our communities. So statistically, trauma often creates more trauma. So if I've experienced trauma, the likelihood of me kind of passing that on, either implicitly or explicitly, is very, very high. And so I also live in North Minneapolis, and you know, after some of the most recent shootings, for example, I found myself in community with folks, speaking with pastors and community leaders and neighbors and parents around what would it look like if we even took, again, a fraction of the amount of resources that we put in towards culpability and evidence collection, towards trauma care and healing. People ask all the time, Irene, how are you going to do this community-centered approach that you're talking about? You're one person. There's hundreds of thousands of people in your district, obviously, you know, 1.2 million across the county. And I believe that it's through our 8,000 person workforce and the individuals who are already in communities desiring a stronger and more vibrant future for themselves and for the generations after. And so I think in part there's there are ways in which we can reinforce existing programs, of course. There's partnering with other organizations. And then there's us getting really bold, because we are faced with challenges today that are compounding with one another, creating issues for our young people and for communities that are getting quite heavy, and how can we change some of these frames fundamentally? Because again, I don't believe our systems are broken. I believe that they don't work for us because they were never designed for all of us to begin with. And so I'm very interested and motivated to make sure that we wind that all the way back and functionally and fundamentally re-examine all of the tenets of how we operate.
Thank you. We'll have just very brief remarks. We'll start with Blang Yang and conclude with Irene Fernando. Again, this is the Hennepin County Commissioner race, District 2. This is a mental health forum sponsored by NAMI-Hennepin, an affiliate of NAMI, Minnesota. Please give us your final summation, Blang Yang, and followed by Irene Fernando.
Thank you all for being here. I look forward to working on these important mental health issues as your commissioner, and I will tell you that when I got the questionnaire, it was daunting. The number of questions that were there, it was amazing. And you know, I think, it forced me to really look at the job and look at, how we address those issues. Because I think what happens sometimes is that, people believe that, county commissioners or other elected officials are so far away from them that they don't see what the problems are. And, I think sometimes that is true. And when that's true, what needs to happen is NAMI or other folks in the community who are, much closer to these issues should bring these to the county board, and they should bring them to the county commissioners, and county commissioners need to do a better job of listening so that we can address these issues. Because I can tell you, I think a lot of times what we think is government isn't doing enough, or the government isn't trying hard enough. And what I see with Hennepin County is that yes, there are some blind spots, but there are a lot of positives as well. And I think one of the positives that I mentioned earlier was converting this workhouse into more beds, more treatment beds for people. That's something that other counties aren't even thinking about doing. And here is the county putting $200,000 into a study of it, and then $13 million set aside to think about converting it into a place for treatment. And so the county is innovative, and the county is trying. And when they're not doing it well, with the child protection system, they bring in other folks outside, like the Casey Foundation, to do its best in terms of analyzing and evaluating and correcting course. And so I think that's the type of county commissioner that I'd like to be, somebody who is looking at problems and trying to solve problems and doing the best I can to really figure out what the inherent problems are and trying to fix those problems. And I don't think that we solve problems just for a specific person or a specific group of people. We solve problems for everybody. And that's the approach that I want to take is, yes, I do understand there are times when we have to look at problems specifically to specific communities and do the best we can to help solve those problems, but sometimes we have to do better in terms of applying it across the board, and that's what the county board should do. You make policies for that 1.2 million people who live within the county, and that's the type of county commissioner that I want to be, somebody who is experienced, that is thinking about what the facts are, what the research says, and making good conclusions so that it helps everybody.
Thank you. Irene Fernando,
yes.
Final remarks.
Of community leadership. And I'm choosing to run for the question, who do I want to serve? I want to serve those who live, work, and spend time in Hennepin County. And I believe that the county can be held more accountable. I believe that commissioners can be held more accountable to setting the vision that impacts the decades to come. I believe we can be held more accountable for having the tough conversations, convening groups that might not always get along, and boldly pursuing and ensuring that all people are considered and vibrant and healthy in our ways of life. And I want to be very explicit about that. I believe that there can be a lot more innovation and creativity in the county. I believe that we should be and can be hiring people of all backgrounds, promoting them to all levels of leadership within the county. For me, I am, in this time, we are kind of at outrageous circumstances when we look to the political community, locally, all the way, federally. And I don't think that it is time for us to kind of stay within the lines of what has been previously created for these roles. It is time to pave new paths with these roles, to test the undiscovered limits of what might be possible for our communities when we are community-centered, when we are people-centered, and we are advancing with equity as the theme and the frame of all we do. And so I would absolutely love to earn your support. It would be an absolute honor to be your next county commissioner. My endorsers see the work that I've done. Come meet with me because my life and the way that I've engaged in this campaign is how I will govern, and that's with equity at the center.
Well, NAMI-Hennepin is very grateful for your time, for your commitment and your investment in community, and we very much appreciate you being with us tonight.
Thank you for having us. Appreciate it.